So another great topic again today, this time on Achilles tendon ruptures again, this time looking at returning to sport without surgery. So those patients that haven't had surgery but like to play sport, how did they go with non-operative treatment? Now, 1/3 of patients that have an operation professionally in America don't make it back to playing after an Achilles tendon rupture. We also know that for an operation, the strength can be up to 14% greater than compared to people who treated what we call non-operatively. Now, that means that most athletes or people that play sport choose not to repair. But what about those people that want to return to sport and haven't actually had surgery, chosen what's called non-operative management? How do they go? So people have actually studied this. There's an article in the Foot and Ankle International Journal looking at how people went 5 years after not having an operation for an Achilles tendon rupture. Now, 89 patients were included in this study, and what these guys did was they got what they called a high sport activity group, people that basically competed in competitive sports and recreational sports to a reasonable level, and they also had what they called a low sports activity group. And what they did was they had 67 patients in the high sport activity group, 22 in the low sport activity group, and they asked these patients retrospectively 5 years down the track how they went. Now, the high sport activity group included things like competitive and recreational soccer, competitive and recreational rugby union, competitive and recreational rugby league. They also included competitive and recreational tennis, basketball, and also joggers, those people that were jogging more than 5 days a week. So that's got them included in the high sport activity group, right? There was then what they classified as a low sporting activity group. That actually included competitive cyclists in that group. They thought that was a low sporting activity. It also included cross-country skiers, and it also included people that ran, but less than that 5 days a week that was in the high sporting activity group. Truck drivers were also included in this, receptionists, labourers, and people that do manual work, and also nurses. So people that do some work, some reasonable activity in their job were included in the low sporting activity group. What they found was that at 1 year post-injury, these people didn't have an operation. 70% of them had returned to their previous level of sport. That was everyone, whether in the low or high activity group. When you broke it down into the groups, 65% in the high activity group had returned to their previous level at 1 year, as opposed to 73% in the low activity group, right? So that's pretty comparable actually to people that have an operation, believe it or not, in other studies. At 5 years post-injury, in total, 73% had returned to their previous level of sport, no matter what their group was, which is only a 3% increase from the 1 year post-injury numbers. However, when you broke it down into the groups at 5 years, 67% of the high activity group had returned to their previous level of sport, as opposed to 91% of the low activity group had returned to their previous level. And that means there was only a 2% increase in the high activity group that had actually returned to their previous level of sport compared to the 1 year figure, as opposed to an 18% increase for the low activity group on their 1 year figure, right? So that's pretty important to know, believe it or not. So what that means, what can we take from this? Well, that means that for those who play competitive sport, 2/3 of you will make it back at the same level, even if you don't have an operation and you're treated well. But for the 30 who don't make it back at 1 year, there's not a lot of chance of you actually getting back there at the 5 year mark. So the 1 year mark would appear to be fairly predictive of how you're going to go. And then for the 3/4 of patients with low activities will make it back to the same level at 1 year. The 1/4 that don't, there's still a reasonable chance you'll make it back at 5 years, so you just keep persisting, right? But these figures are actually very comparable to people that have an operation, although there are some limitations to this study. There's something called recall bias, which basically means these patients were asked to look back at what they were like a couple of years prior and try to remember it. Now, my memory is not fantastic, and this could affect the patients in the study as well, and that can affect the results. But look, thanks for listening today. I hope that helps, gives you some idea of your return from injury. As always, log on to www.hunterfootandankle.com.au for more information on foot and ankle injuries. Thanks very much. Bye.